Dr. Isaac Bogoch is an infectious diseases physician and a member of Ontario's vaccination task force. Dr. Bogoch, good to see you again. Thanks once more for taking time to speak with me tonight. Appreciate it.
My pleasure.
Look, help us understand what effect this surge in cases of COVID-19 is having on, in particular, the healthcare system, the hospital system in Ontario. What are you seeing? What kinds of decisions are being made about patients and their needs right now?
Yeah, sadly, this is really starting to overwhelm the healthcare system such that we're at a point where we actually have to provide less care to people in Ontario. So the big example here is that scheduled surgeries are being canceled. These are sometimes, I think, inappropriately referred to as elective surgeries, but there's nothing elective about them. These are surgeries that people need to have. They're heart surgeries and bone and joint surgeries and sometimes cancer surgeries. Like, they're important. They need to have them. And they're being canceled now because we have such an influx of patients with COVID-19. We really need all hands on deck and all resources available to care for those patients with COVID-19. So, it's obviously a very challenging position right now for healthcare in Ontario.
There are 619 patients in intensive care units in Ontario hospitals, 408 of them patients on ventilators. And I'm not sure you know the answer to this. I mean, how does that compare to non-pandemic times, or do we have something to compare this to?
Not really. I mean, it's interesting because people talk about the beds available, but of course the beds themselves don't tell the whole story. We know that patients with COVID-19 certainly require more care and more resources. The prior high mark, by the way, during wave 2 was 420 patients admitted to intensive care units, and now we're north of 600 patients. Like, this is a huge burden on our system. The ICUs truly are filling up, and you don't have to look too hard to see the outcomes of this. We now have, for example, adult patients that are admitted in pediatric intensive care units. We have adult patients that are being flown 50 or 100 kilometers away to other intensive care units where they can receive care. We're being stretched. We are certainly being stretched, and there's a lot of redeployment to get the appropriate number of hands on deck to really ensure that we get quite frankly, the appropriate care for patients coming into the hospital.
Yeah, let me touch on that.
Surgeries will help.
Yeah. Okay. Let me touch on the redeployment question, because it's a broad conversation now taking place in the land. I think the cancellation or postponement of these, let's call them non-urgent procedures, I guess if I can put it that way, are supposed to free up between 700 and 1,000 additional hospital beds for COVID patients. The extra beds are important. You touched on beds, but do hospitals have the staff to care for those additional COVID patients?
Right. I think that's the critical point there, and I completely agree. It's one thing to have a physical bed, but it's, of course, another thing to staff it. Staffing intensive care unit beds is challenging. It is a very dedicated skill set, right? And it's not just a doctor. There's a huge team, and every piece of that puzzle is essential. Like intensive care unit nurses and intensive care unit respiratory therapists and physiotherapists and occupational therapists and dietitians, and on and on and on. They all have an integral role in caring for a patient admitted to an ICU. I would say the same is actually true for the hospital wards as well. So even when you're redeploying people, it's important that they have the right skill set so that patients get the care that they deserve. It's challenging now. It really is. And sadly, it's not going to get better. It's going to take at least a week or so before we crest. So I think we really need to brace for more and more people coming in, and we've got to free up as many beds as possible, but also free up as many capable and trained hands to help care for those patients as well.
Yeah, we're talking about the situation in Ontario as an example. I mean, there are other provinces as well dealing with these challenges and surges in cases. And I guess I'm wondering if you think there's a broader role for the federal government here in terms of pulling healthcare workers perhaps to a province such as Ontario or other hard-hit provinces, from provinces maybe doing better. Should we be having that conversation and perhaps at a higher tempo here?
Yeah, I think people should know that there already is communication on an ongoing basis between federal and provincial health ministers. So it wouldn't be the first time that people have had to come in and help out. Whether or not that's needed now is debatable. I think currently we have the capacity, but of course that might change. And I think it's important to be open-minded. Like, maybe there will be a point that some provinces will need help from outside provinces. There are mechanisms to do that. There certainly are. I don't know if any province is at a state where they would require external help, but there certainly are mechanisms to accommodate for that.
Okay, let's finish on this. What's the biggest thing that concerns you now as you look down the road?
Capacity. Healthcare system capacity is the immediate threat, but of course, I think we really also need to pick up the pace of vaccination, and that will help. But lastly, I really don't think we're going to vaccinate our way out of this third wave. We're going to require sound policy to get our way out of this third wave. Vaccination will help shape this wave, but it won't end this wave. We're going to need policy to end this wave, and then we need to vaccinate like stink so that we don't have any further waves.
All right. Always good to get your perspective, Dr. Isaac Bogoch. Thanks for talking to me again. Take care.